Thank you everyone for joining us for this new addition to our Family Connections library. This one is called, What is Mental Health? The focus of this family connection is understanding mental health as well as distinguishing between typical mental health concerns versus mental illness. We'll also review how to promote good mental health for children and adolescents. My name is Joyce Hawkins, and I am a family outreach representative with the Office of Family and Community Engagement, and I have the pleasure of being your facilitator for this information session. Let me introduce you to our amazing panelists. First, we have Dr. Mariah Davis. She is a licensed clinical psychologist and school psychologist who provides comprehensive services to middle and high school students at Renaissance Academy. She started working with Virginia Beach City Public Schools as a doctoral intern in 2022. That was after she had came from a doctoral program in Philadelphia. Thank you, Dr. Davis, for joining us tonight.
Hey, everyone. Thank you for having me.
And next, we have Dr. Suzanne Farley. She is a licensed clinical psychologist and has been with Virginia Beach City Public Schools since 2005. She currently serves as a psychologist with a couple of our VBCPS elementary schools and at the CSEP Re-Ed program at the elementary levels. Thank you, Dr. Farley.
Hello, thank you.
And last but not least, we have Dr. Stacy Simon. She is a licensed clinical and school psychologist who provides comprehensive services to high school students, including those with significant mental health needs. She has worked with Virginia Beach City Public Schools for 16 years. Thank you, Dr. Simon.
Hi, thank you.
Well, ladies, thank you so much for your time tonight. Please take it away and let's have this information about what is mental health.
Okay, so we're going to get started with a definition of mental health. And this comes from Oxford Languages, which is the organization that updates the Oxford Dictionary regularly. So their definition is a person's condition with regard to their psychological and emotional well-being. So that right there tells you that what we're looking at when we talk about mental health is well-being versus mental illness, which is more where we're looking at when there's a problem specifically.
So just like with physical health, when we think about mental health, we want to pay attention not only to potential concerns, but also to signs of well-being. So some of those include an interest in activities and learning, the ability to handle age-appropriate difficult situations or feelings, and resilience. So the ability to bounce back from setbacks and not be consistently overwhelmed by everyday challenges. So for an elementary child, that might be being able to deal with losing a game. For an older child, it might be being able to bounce back from a grade that was not as high as the student hoped for. Other signs of good mental health include relationships that the student enjoys with friends and family, appropriate self-esteem, so not meaning that the student may not be aware of their weaknesses, but that they do have an overall positive view of themselves. And then the experience of positive emotions. So again, this doesn't mean that your child never gets sad or anxious or frustrated in response to situations where we would expect those, but just that they also show positive emotions throughout the day and that they laugh and smile as you would expect.
Okay, so this is a section where we're really going to look at the difference between mental health and mental illness, and we'll look at a few examples to try and help with that understanding. So this here is the definition of a mental disorder, and this is from the DSM-5-TR. So that's the manual that is used to diagnose mental illnesses. So if you have a diagnosis, if you know anyone with a diagnosis, this is where it came from, that manual. In the beginning, it has this definition, this general definition for what a mental disorder is. So if you want to pause for now and just kind of look it over, I'm not going to read it word for word, and then we'll come back to it and I'll call out a few things. Okay, at this point, you should have read that definition. So I want to point you to what's highlighted and what's in red, clinically significant and significant. So what that's telling us is if there is a problem, then it has to be a high intensity of a problem. And it has to also be for a long duration. So those are the two main things that would distinguish this as a mental disorder from something that's just, oh, they're struggling, they're having some difficulty, but either it's not very intense or it doesn't last for a long period of time. Also, where it's highlighted, it's an expectable or culturally approved response to a common stressor or loss, such as the death of a loved one, is not a mental disorder. So we want to make sure that we're recognizing that things that are normal, a normal response, even if it's a negative response, as Dr. Farley had said before, isn't necessarily a mental disorder. Okay, now some examples to kind of get that to sink in. Fear or anxiety versus a phobia or an anxiety disorder. So we'll start with the first one. Kim's dog bit her. So there could be two responses to this. One, Kim is nervous around her dog and avoids her for a few weeks. So understandably, she's nervous, the dog bit her, but if it wasn't an intense bite and she's able to kind of gauge that, then she can, after a few weeks, get back into a normal routine. Whereas if she's extremely fearful around all dogs and avoids all dogs for 6 months or more, that would be more part of the criteria for a phobia or a disorder that needs treatment. So next, we're looking at Joey failing a math test. So let's say Joey's in high school and he just failed his first math test. The first response could be he's anxious about his next math assignment. So he has an assignment coming up, he's experiencing a little bit of anxiety, but he's able to move forward with it and take it, regardless of if he does well or not, he's able to continue to engage. Versus maybe the second response, he begins avoiding classes, becomes excessively worried about his academic performance, not even just in math, but other areas as well. And he starts to have trouble sleeping, and this lasts for the rest of the school year. So that would be more criteria that would fall under an anxiety disorder. So that might be where you start getting concerned and maybe we need to get some extra help. Okay, so then in the area of sadness, similarly, sadness or depressive disorder. So we know that sadness is good. All of our emotions are good. It can help us identify solutions. It can notify us that something's wrong or notify those around us that something's wrong. But too much sadness or too much emptiness or irritability and for far too long without having a solution can be bad. So if we're not identifying solutions to the problem and it continues to go on and it gets worse and more intense over time, then that could be part of what might meet that criteria for a depressive disorder. And you might need some extra help at that point. Okay, and these are some more examples. So I have the next few slides goes over a lot of different things that could be typical versus not typical and cause for concern. And this is primarily geared towards adolescents. So I'm not going to read all of them. So these are a few where if you want to pause and look it over and read it for yourself and then come back and I'll give a few examples. Okay, so let's start with one, typical increased moodiness. So when your child is going into adolescence, they're going to get more moody. That's typical. But what's not typical is intense, painful, or long-lasting moods, risky, mood-dependent behavior, or major depression, panic attacks, or self-injury or suicidal thinking. So those would all be things that would fall under cause for concern. Okay, another slide with some examples. Typical experimentation with drugs, alcohol, or cigarettes. That's typical to do experimentation when you're moving into adolescence. But what's not typical is substance abuse, selling drugs, or substance using peer groups. So those would be more of a cause for concern. And then on this last slide, I'll give an example. The first one, increased sexual maturation, sexual interest or experimentation. Just like with that first slide, when you're moving into adolescence, you start experimenting. But what's not typical is unsafe sexual practices. So you want to make sure that your adolescent is being safe. And if they start engaging in something unsafe, then that's a cause for concern. And you'll need to talk to them and maybe get some additional support.
So now we'll turn our attention to discussing how to promote good mental health. So studies suggest that excessive cell phone and technology use can have harmful effects for both children and adolescents. Brain development requires real-world interactive experiences to prepare for adulthood. Social media use in particular has been associated with increased risks for depression, anxiety, and suicidal thoughts, particularly among girls. App developers have designed their social media platforms to keep people hooked on their sites, and children and teens don't have the judgment and self-regulation skills to limit their use. Cell phones and technology have also been linked with fragmented attention or symptoms that are often seen in ADHD. It's difficult for children and teens to be attentive to real world learning and experiences when their devices are within arm's reach. So for example, focused classroom learning can be less stimulating than the colors and sounds and the images of social media and the music on their phones. Digital information is often presented quickly, such as TikTok videos of a minute or less, which impairs students' ability to sustain attention for longer periods of time. Smartphone use, especially before bedtime, can also disrupt sleep patterns. This includes taking longer to fall asleep, reduced rapid eye movement or REM sleep, and lower alertness the following day. Poor sleep quality is also a significant factor in mental health challenges. So are there any benefits to cell phone and technology use? Yes, there are. Some of the benefits include creative use of technology for education and using apps such as FaceTime to maintain social connections with family and friends across the miles. Caregivers can play a role in monitoring technology use. So for example, you might consider limiting the amount of time spent on phones or devices and monitoring the sites that your children are on. Also, you might designate specific times or events as phone-free, such as family meals or outings, and ensuring technology is put away before bedtime. So turning now to unstructured times for play and connection, I included this quote that play is the work of childhood. Wire up your brain by playing vigorously and often. This really emphasizes the importance of that unstructured free time for children and adolescents to kind of play and explore and do things on their own. Having this unstructured time helps to develop skills in multiple areas needed for a healthy life. I included this picture of the kitten as kind of an analogous situation. So when kittens are young, you might often see them playing with balls of yarn or pouncing on feathers. And this really shows that these play activities will be useful for them later in life when they are hunting prey for food. They are learning those skills at a very young age. And so our children, when they are young, are really working to learn and build those social, emotional, and behavioral skills and the interpersonal skills that are necessary for independent living later on when they become adults. And it's important to avoid overscheduling students. Certainly, it's great for them to be involved in clubs or sports or community activities, things after school. But it's also important for them to have some downtime. We want to encourage free play and time with friends and family. And there's even an element of allowing children to be bored sometimes, because that can stimulate creative thinking and imagination as they're thinking of ways to fill their free time. For good mental health, it's also really important to take care of your body. Mental health is just one component of overall well-being, and they all kind of work together. So physical health, emotional health, mental health, and so on. So I've included a list of activities that are healthy for promoting overall well-being. And I've also included this acronym on the side. So please remember to treat physical illness, limit screen time, balance eating, avoid mood-altering drugs, balance sleep, and get exercise. And all of these will help to support a healthy overall lifestyle.
How we respond to our kids when they're sad or anxious or angry, or when they're experiencing difficult emotions, can enhance their mental well-being as well. So first of all, remember that it's not your job as a parent to prevent your child from being sad or anxious or upset, or to fix things and make them feel better. It's our job as parents to teach them how to cope with those feelings and to teach them that they're a natural part of life. So we can do that by modeling positive coping skills ourselves when we experience those feelings in our lives. And when we respond to those feelings in our kids, we want to avoid the extremes of either catastrophizing and sending kids the message that what happened is worse than it really is, or dismissing and sending the message that our kids' feelings aren't valid or that we don't understand or don't care about their feelings. So, for example, when we make catastrophizing statements like, I can't believe they did that, or I'm so sorry, that's horrible, we're sending the message to our child that the situation is worse than it may have really been. On the other side, when we make dismissing statements like life isn't fair or don't be sad, we're showing that we don't really understand our child or that their emotions aren't valid. Instead of that, what we want to do is validate our child's feelings and empower them to respond effectively. So we can do that with statements like, it can be really hard when we can't have what we want. What do you think you can do to help yourself feel better? Or, I'm sorry that happened. It would make me sad too. What are you thinking of doing about it? Statements like that validate your child's feelings and encourage them to focus on their response, either by having them problem solve themselves or by suggesting a solution if they need guidance. And lastly, we want to be mindful of how we talk with our kids and the messages that we send so that we foster helpful beliefs in our kids, because our kids' beliefs, both about themselves and the world, can impact their mental wellness and their ability to deal with difficulties. For example, a child who believes that he can't control himself because he has anger issues may believe that he has no power to choose more effective responses when he's upset. And that can be a scary and a hopeless belief for a child. So, whether your child has a mental health diagnosis or not, try to avoid language that sends the message that they can't do certain things. Instead, help them develop a growth mindset with statements like, it's hard for you to stay calm when you're upset. The more you practice, the better you'll get. Similarly, unrealistic expectations about the world can also impact kids' mental wellness. For example, a child who believes that other kids should always play with them or they shouldn't have to do things that they don't like, or that others should avoid things that make them mad, will be more upset by everyday situations than kids who have more realistic beliefs. So we can be mindful of our words to encourage helpful beliefs instead of unhelpful beliefs. So, for example, instead of saying things like, I can't believe they didn't want to play with you, we can normalize the experience with statements like, sometimes people don't want to play. Did you decide to play with someone else or play by yourself? So statements like these help kids respond more effectively to situations that they will encounter later in life and will encounter often. It gives them the tools they need to be successful.
All right,
Well,
thank you everyone for listening. These are our email addresses up on the screen, so I just wanted to make sure that you all had those. And you can feel free to reach out if you have any follow-up questions.
Thank you, ladies, so much. Dr. Davis, Dr. Farley, Dr. Simon. I know I'm certainly going to be using your guys' email a lot now. I have learned so much in this presentation. It was so informational, and we have such relatable techniques and activities that we can just try right now. I've got 4 kiddos, and I can already think of at least 2 or 3 that I'm going to try as soon as we get home tonight. So your expertise, time, and dedication to our students is greatly appreciated, and it is evident in everything that you do, especially this presentation that you were able to share with our community. So next, again, thank you to you all, and thank you, audience. Thank you so much for tuning in and watching this informational session. You can watch it as many times as you need, because sometimes you just might try a technique or activity and might not work, but these ladies have provided a few for you to try in this information session about mental health. So thank you all very much. And again, we'll leave this on the screen for another few seconds or whatnot. But please utilize these wonderful ladies and their expertise. And ladies, thank you so much. We greatly appreciate all that you do for a BPCPS and again, now our community. All right.
Thank you.
Thank you.
Thank you.
Thank you. All right, you guys all have a great night.